Welcome, dear all. Here we have the chief guest today, and she is Dr. Shahina. So, first of all, let me congratulate Dr. Shahina from the bottom of my heart, from the team Marrow, and everyone else for securing first rank in the NEET SS exam. Hats off to you.
Thank you so much, sir.
What I know regarding you is yeah, you are from Kerala and you have completed MBBS
Yes,
from Trivandrum Medical College in the year
yes, sir.
2013. Then you pursued DNB Respiratory Medicine from Cosmopolitan Hospital. That
Yes,
was
sir.
completed in 2019, I think. And then you were working there as a consultant also for the last 4 or 5 years.
Junior
Then you
consultant.
started preparing for the exam. Yeah, yeah.
Yes,
You have completed the DNB in 2019. So there is a slight gap there. So was it a
yes,
hindrance in preparation to the DM exam? Some people
definitely,
said
sir.
that you might be out of touch. You have lost the
Uh,
main connection with the updates. So did you feel like that?
yes, sir. It is definitely a problem. But 1 year before, I have cleared my MRCP exam, respiratory medicine
Ah,
MRCP exam. So it helped me a lot because I started learning from scratch during that time. That
okay.
was 1 year back, and also I
Okay.
have cleared EDARM. So
Ah,
during that time also I had brushed up through the topics. So
okay.
I think that helped me in this.
That ignited the
It will,
fire in you.
yeah, yeah.
Okay. So when did you made a plan that you have to go for the DM because you were already working there,
Yes, sir.
or why did you make a plan?
Before 6 months, I definitely don't have any plan to get into
Okay.
DM. Before
Mm.
6 months, I was planning to be a consultant in my hospital itself,
Ah, yeah.
but
Mm.
unfortunately, during that time, there was no vacancy available. So I have
Okay.
to think further. Either
Mm.
I have to go to some rural places and take as a consultant, or
Peripheries. Okay.
in peripheries and to
Mm.
work as a consultant, but
Mm.
that I didn't feel good about it, so I
So
started to learn.
okay.
So I thought
So
I
what
have to
we
learn.
learned from your experience is that it is not. It is usually told that it is easy for those who have completed MD or DNB and writing the exam fresh within 1 year has got a upper hand. That is the usual belief, and you have corrected that age-old belief. And even with a gap of this much years, you succeeded in securing the first rank, and that deserves a special mention. And
Thank you, sir.
you told that you have started preparing for the last 6 months or 8 months. So how
Yeah.
was the beginning? How did you brush up, or how was the initial
Uh,
steps?
I properly started studying from the month of November, sir. November, December, I was working and studying, so it was difficult.
Okay.
I have
Mm.
no idea how to start. So I subscribed Marrow first, and I
Okay.
heard all the classes, all your lecture classes from November and December. I have completed your classes, and
Okay.
after that, I also alongside I was doing the grand test even during the start itself. I have done the grand test because I want to
Okay.
get the idea how the exam
How the
pattern
exams
is,
are.
because
Correct.
yeah, because I don't have any previous experience. I didn't attend any
Mhm.
NEET SS exam before. So to
Okay.
get that clarity from the starting itself, I have done the NEET SS grand test in your modules, even the previous year test also.
Okay.
Every two to
That is
three
also
days I'll
available.
attend. Yeah, sir. Every 1 week I'll do one test at least. So I
Oh.
started getting the idea how to learn. And meanwhile, I was only seeing Marrow videos. I didn't start studying the textbook. But
Okay.
at the end of December, I started feeling that this is incomplete. I have to start from textbook also. So I started
Mhm.
textbook based on the questions, whichever area that more questions come. Like that, I have studied
Okay.
the textbook because it is not possible to complete the textbook.
So, if you cover the topics or the modules in Marrow and then you read the same in the textbook, you find it much more easier to
Yeah,
grasp.
yeah, it is very, very easy, sir.
Okay. So, how about the topics, the modules that we have discussed about the selection
All
of
the
modules,
topics
topics
all the modules were very important in exams. I feel so. And I have a suggestion that some more topics to be added,
could be added?
like occupational, yes, like occupational lung disease, connective tissue disease,
Okay.
because these
CTD.
things are also, but
More
otherwise,
commonly.
all the topics, yeah. I know the difficulty, but still, all the topics you covered was excellent, sir. It was very easy to read after hearing your classes. First 2 months, I have fully heard all your classes, and after that, I started expanding more of my studies.
Okay.
That was
Any
my
specific
strategy.
topics you would like to recollect whether you benefited from the maximum by hearing to the
Um,
class?
uh, Lung cancer initial classes about the epidemiology and all, it was very useful.
Mhm.
So told about the genetics of lung
Yeah.
cancer. Everything was very useful. Then community acquired pneumonia, I really like that topic, how you covered it. NTM was excellent, sir. I
TM.
didn't yeah, sir, I didn't read further from any textbook or anything. NTM,
Okay.
it's your class only.
So, is the notes which is given along with the modules, is it useful, or do you make your own notes after
I make
listening to
my
the
own notes.
modules?
I made my own notes because I don't think it is difficult for me to remember the what to say screen based study. It's not workful for me. So I have handwritten notes of every classes I hear.
Okay. You make your own notes, and that's good. And
Yes, sir.
at the end of each module, there is a summary as well as a short MCQ session. Is that bring any benefit?
Yes, sir. Yeah, it's excellent, sir. So I have a
Okay.
suggestion that before
Okay.
it should not be in the end, sir. You can discuss when the topic is it's like you can ask the question and then start the topic. It will be more helpful, sir.
Okay.
I like the
Regarding
way
which, so, uh,
yes, sir. Yes, sir.
okay. So I will
It's just
try
my
to take
suggestion,
that
sir.
sense
I
out.
don't know.
Sure, sure. That's a good thing actually, because during while listening, also students can identify which is the area which is more important. That is your idea, right?
Mm. Yeah, yes, sir.
So, how you felt about the Marrow is an entire package. So that includes not only the pulmonary medicine. If you subscribe, you can get the critical care videos, the
Mm,
general medicine.
mm,
Dr. Rakesh is
mm,
there. Then
mm,
cardiology is there. So, how will you
mm.
assess? Did you listen to their classes also in between? Was it useful?
No, sir. Actually, I have
Mainly,
heard only the
pul-
pulmonology classes. ARDS,
that
some classes I have heard, and I think lung cancer treatment aspect I have heard the radiology,
oncology,
oncology
Dr.
session.
Vishnu's.
Uh,
Okay.
uh,
And you have
no other
did
classes.
not have much time also to go through all.
Yeah, yes, sir. Yes, sir.
Okay. So regarding the last minute preparations, did you have a revision time, or when did you start relooking what you have learned?
The entire March I kept for revisions, sir. I didn't learn
Okay.
anything new during the last month. That was my plan
Okay.
from beginning. Also, I
Okay.
have a habit of revising each topic every week, sir. Even
That's
from the
a
beginning, I start. So even
continue,
from the
continue.
beginning, I start studying. I revise every weekly because it's difficult for me to recollect everything after during the last month. I will get panic. So I have a habit of revising everything weekly itself, sir.
Okay. That's a very good strategy, actually. I always tell to my
Mm,
students also. That is what you have
mm,
learned during 1 week shall be
mm,
revised at the
mm,
end of the week. And that it makes
mm.
it more clear.
Yes, sir.
So you have gone through all the mock tests. Was it
Yeah,
useful?
yeah, all the mock tests. Very, very
Okay,
useful, sir. Not just NEET SS mock
thank
test,
you.
I have attended other NESS exams also in your module.
Okay. So regarding the exam pattern, I think one of the student told me that it is a 50-50-50 sessions like that.
Yeah.
So can you tell
Yes.
regarding that the time management, the questions, this 50-50-50 pattern, so that the students will also get an idea regarding the exam.
I find it really useful, sir, because at
Okay.
the we had enough time, sir. The questions were
So
not so
how the
twisty.
questions are divided
Short
actually?
50 first session will be 50
50.
questions. At the
Okay.
end of that time, we'll naturally go to session B. Even if
Oh,
we
that
complete
also.
or not, yes, sir.
Okay.
Uh, we'll go to the next session. But if we go jump from without completing from session A, we if we go to session B, we cannot
Mm.
come back to session A. That is the problem.
The,
So always
okay.
write the 50 questions, revise the 50 questions, then only go to the next session.
Then only. That's an important point, and because there is no coming back.
No coming back.
Similarly, from B to C also it is like that.
Yes, sir.
So
But
if you are
actually, we
doing
can revise after the 50 question. We can just go and rapidly rush through all the questions you have answered. Uh,
mm.
so I think that helped me.
But the other side is that when you go through the session C, you suddenly get a rethinking that one of the questions that you have answered in the first session is wrong and you want to correct. There is no way.
I don't think I didn't have that experience, sir, because I have
Mm.
gone through, revised it, rebrushed through it one more time. I
Okay.
got twice. I got time to revise it twice, sir.
So regarding the number of questions, how much did you attempt among 150?
I have attended all, sir, 150
All
questions.
questions. Okay. So you
Yes,
should
sir.
attempt at least more than 90% so as to be in the
Yes,
initial track or initial ranks. This is what I feel.
yes, sir.
I think
Yes, sir.
your
I
strategy
tried.
was the correct one. And regarding the
Mm.
first session, 50 questions, how much time did you take to complete before the revision, the initial
Before
run?
for I think for within 40 minutes I have completed it,
So you
and
got 10
I got
minutes to
10
go through.
minutes time. Yeah, yeah, sir.
That is for the same for the session, second session and third session also, more or less
Third
the same.
session. Yes, I have marked
Okay.
some questions from session A, the doubtful questions in session A
Okay.
during that time, and at the end of 10 minutes, I go through that mark sessions first. Then I go through every questions.
Okay. So how do you mark those
There is
who
a
got doubts?
icon.
Option.
There is
Okay.
an icon there, sir. We can
Okay.
keep the mark and we can attend the same time, sir. We can attend the
You can
question
attempt
and
also.
mark that question for you. Yeah.
If you have marked, you can come back and change the what you have marked also.
Yeah.
Okay.
But if we don't get time, then it will be marked as your answer. What you have attended.
If you don't get time,
If we can mark the question, we can attend the question and we can mark it as mark for review.
okay.
And if we didn't get time to review the question, the
Mm.
answer which we are given will be taken as your answer,
Final
final
answer.
answer.
Okay. Okay.
Yes, sir.
That is correct. Okay. So, which all are the areas that you feel that more questions have come from? I felt what I felt was the myositis related ILDs, the cystic lung
Uh,
disease,
uh,
such kind of
yes, sir.
areas, occupational lung disease,
Lung
and
disease, pleural
what about
effusion. There was two, three
pleural effusion
questions.
was there, empyema was there.
Uh, not
Then,
direct questions. Pleural effusion.
uh,
They ask in a twisted way.
okay, and
Hmm.
some straightforward
They.
questions were also there.
Oh,
Just
yeah,
if you
yeah.
know the answer.
Definitely. Yes,
And
sir.
is there any, how many case scenarios, if you can recollect, like a patient
Mm,
presented with so and so, like that?
how many I didn't know, but
But there were
in
a
each
few.
50 session there were enough questions there, sir.
like clinical. Okay.
I think when we study also we have to study based on the case scenario. That will be
Yeah.
useful because
Correct.
when the question came, we'll get the idea how to
Right.
answer the question.
Okay. So basically, if you a student who is practicing very well in the MD time and doing
Mm.
the
Mm.
clinical jobs very well, will be able to
Ah,
excel
yes,
also.
sir. Yes, sir.
That is
Yes, sir.
also it's an important point because I always tell that the patients are the best teachers.
Ah, yes, sir.
Okay. And any other advice that you would like to give to the new generation?
uh, First of all, trust yourself. Maybe
Yeah.
in my case also, it was very confusing whether I will get into it after 5 years of my graduation. It is a very
Yeah.
doubtful scenario. So I think the most important thing is we have to trust ourselves first, and we have to push. Uh, we have to consistently work for our goals. Try to put your effort maximum per day because it is very important. Some days we can better perform, but some days it will not be like that. Some days our focus will be we will be out of focus. But don't give up. Try to give maximum as you can. And one more thing, attend maximum exams.
Yeah.
It will help you a lot. It will help your confidence, boost your confidence, and it will also help in your studies because we can understand whichever topics are very important. We can go through that topics. When we find that topic, when we read that topic, we'll get the idea. This was a question previously asked,
Correct.
so we can gradually while we're studying, we'll get
Mm.
the questions. This can be asked as a question. This can be asked as a question. Like that, we'll get such ideas if
Mm.
we attend the questions more frequently.
Correct.
From the beginning itself, we have to attend the exams. Even if we don't know anything, it's a good idea to start with exams. I think so,
Correct.
sir. Then always revise
Correct.
whenever you get time. If one day you don't feel like studying, then you revise. Give that time to revision because it's not much effort, and also you'll feel better after revising.
So what I learned from your experience is that even after a gap of couple of years after your MD or DNB exam, it is still possible to shine through the competitive exams like this. You are the best example
Sure,
for
sir.
that. First thing. Secondly, what I learned is that you told very important point regarding revising because what you learned for a week you have revised at the end of the week. That's a very good strategy. And third
Mm,
point is that you have dedicated the last entire month for revision. You told that you learned nothing new during those times.
mm,
You are
mm,
mainly focused on revision, and these
mm,
things are very useful for those if someone else is hearing. These are the points that you learn from Dr. Shahina's experience, I think. So
mm.
once again, congratulations to Dr. Shahina, and you have made
Thank you,
yourself,
thank
your family, and your teachers and team Arrow very much proud. Thank you, and wish
thank
you
you, thank you, sir.
all the best wishes. Thank you.
Thank you, sir. Thank you so much, sir.